F. W. Taylor, Administrative Theory, applied to hospital management. Look at this picture shows that Taylor's scientific management applied to hospitals and healthcare administration. Look at this. A detail going on. Frederick Winslow Taylor is known as the father of scientific management. He focused on improving industrial efficiency by applying scientific methods to management and labor processes. Although Henry Fayol is more commonly associated with administrative theory, Taylor's ideas from the basis of scientific management, which is an important part of classical management theory. Key principles of Taylor's scientific management. 1. Science, not rule of thumb. Taylor argued that work processes should be studied scientifically, not based on traditional or trial and error methods. Time and motion studies, standardized tools and procedures. 2. Scientific selection and training of workers. Instead of letting workers choose their own task, Taylor suggested hire workers scientifically based on capability, train them systematically for efficiency. 3. Harmony between workers and management. Taylor emphasized cooperation rather than conflict. Managers plan and supervise. Workers follow these scientifically determined methods. Encourage the mental revolution for mutual benefit. For division of work and responsibility. There should be a clear separation between management, planning, supervising, designing methods, workers executing tasks. 5. Differential piece to rate system. A wage system that rewards efficient workers. Higher wages for those who meet or exceeds standards. Lower wages for those who do not. Techniques of scientific management. Time study, measuring time taken for each job. Motion study, eliminating unnecessary movements. Standardization, tools, equipments, work methods. Functional foremanship, 8 specialists foreman supervising workers. Fatigue studies analyzing rest intervals to reduce worker fatigue. Contributions of Taylor: improved production productivity in introduced scientific methods in management, laid foundation for modern industrial engineering. Criticisms by humanistic thinkers: 1. Overemphasis on efficiency. 2. Viewed workers mechanically. 3. Reduced worker autonomy. 4. Ignored social and psychological needs. Applications of Taylor's scientific management in hospital and healthcare. 1. Time and motion study in clinical task, studying how long procedures, example blood sampling, dosing change, medicine administration, take and identifying unnecessary steps helps improve efficiency and reduce patient waiting time. 2. Standardization of procedures, creation of standardized protocols for activities such as hand hygiene, patient admission and discharge, medication administration, reduces errors and ensures uniform quality of care. 3. Scientific staffing and role allocation, using workload analysis and skill evaluation to assign the right person to the right job. Example: triage, nurses, specialist, technicians, emergency responders. Functional foremanship in hospital departments, separating planning from execution. Nurse managers plan schedules. Clinical supervisors monitor procedures. Quality officers check compliance, ensures focused supervision and accountability. 5. Use of incentive based performance systems, introducing rewards for efficiency and quality such as reduced patient waiting times, low medication error rate, high patient satisfaction scores, motivate staff to follow best practices. 6. Improvement in inventory and supply management, scientific methods applied to manage drug inventories, surgical supplies, equipment maintenance, minimizes stockouts and wastage. 7. Designing efficient workflows in emergency and OPD, Time study based redesign of patient flow reduces congestion such as streamline triage, fast track pathways, optimized bed turnover. 8. Training and skill development programs. Structured training based on scientific findings, example reducing movement during IV insertion, helps new workers adopt efficient techniques quickly. 9. Fatigue study for nursing and clinical staff, scheduling proper rest breaks, rotation, shift, and workload distribution to avoid fatigue and reduce medical errors. 10. Data-based decision making and continuous improvement. Continuous measurement of turnaround time for labs, average length of stay, and surgery preparation time using these metrics to improve hospital operations scientifically. Thank you. Have a nice day.